Hi, today I'm here with Dr. Deborah Vidal, Professor of Psychology at the University of Central Florida. And today we're going to be talking about anxiety disorders. Thank you very much for being here today.
Thank you for inviting me. It's a pleasure to be here.
So my first question is that some parents, if they're worried about their child being overly anxious, how can they tell if their child actually has an anxiety disorder?
Well, there's a couple things that we ask parents to keep in mind when we're talking about whether or not a child has an anxiety disorder. One is to look at the level of distress that a child might have. So, for example, if a child seems to go into a situation and they seem to be a little bit uncomfortable, but after about 5 or 10 minutes they calm down and they're having a good time and they're playing and they're laughing, that's not something that we as clinicians will worry about. So we talk about significant distress where children are crying, refusing to go to places and do things. The other is functional impairment, and that means, again, are they not doing things that kids should be doing? So are they not going to birthday parties? Are they avoiding school? Are they refusing to play on a baseball team even though they love baseball because their anxiety may be too severe? Another thing that we think about in children is really the developmental appropriateness of a fear. So it is normal for 3- and 4-year-olds to be afraid of dogs, to be scared when they hear a lawnmower. But we don't have that same expectation when children are 12 or 13 years old. And fear of the dark is a very good example. Lots of little kids are afraid of the dark, not many 12-year-olds. So if the fear is not developmentally appropriate, that's another sign that a child may have an anxiety disorder.
And what types of professionals in the community may help a parent go through this assessment procedure?
Well, there are different types of professionals. There are a number of pediatricians who have been trained. There are a number of clinical psychologists, psychiatrists who may have training, who are trained as child clinical psychologists, child psychiatrists, who may be able to help parents determine whether or not their fear is normal or abnormal in the child's particular case. Also, sometimes even school counselors may be helpful because they've seen a lot of children, and so they can help parents judge whether or not this fear is abnormal.